Hi there, my name is Dhruv Nair. I'm a PGY5 in the General Internal Medicine Training Program. This is my project entitled Patient Experiences with Telephone Visits for Ambulatory Care Sensitive Conditions. As most of you know, Women's College Hospital is a large academic ambulatory care hospital in Toronto, Ontario. With the COVID-19 pandemic and the launch of virtual care billing codes, telephone visits now account for the vast majority of all patient visits in the Department of Medicine at Women's College. But despite widespread adoption, patients' experiences with telephone visits for ambulatory care sensitive conditions are not known. So what we sought to do with this project was to characterize patients' experiences with telephone visits for ambulatory care sensitive conditions in the Department of Medicine at Women's College Hospital. How we did this was that patient experience surveys were administered either by telephone or by email to all patients who consented to be contacted following a telephone visit at Women's College Hospital between October 2020 and February 2021 for one of the following 7 ambulatory care sensitive conditions that are listed in the bottom left-hand corner of your screen. What did our results show? So a total of 172 patients consented to be contacted, of which 80 patients completed the survey, which represents a 47% response rate. The mean age of our respondents was 63.2 years, or sorry, 63.9. About 2/3 of our respondents were female, about 2/3 were Caucasian, and the vast majority, over 90%, rated their ability to speak English as well or very well. And what did our responses show? So some high-level responses were that 92% of respondents found that their telephone visit was very helpful or somewhat helpful for the medical issue for which they sought their appointment. And over half of respondents rated their experience receiving care as equal or better than an in-person visit. 23% would have preferred a video visit compared to a telephone visit, but over half of patients said that they were happy with a telephone visit and would not have preferred a video visit. The vast majority of respondents felt that the telephone visit certainly saved them time as well as money compared to an in-person visit. And half of patients wanted the opportunity to continue having telephone visits after the pandemic is over. Asking patients what they would have done if this telephone visit was not available to them, interestingly, just about 10% of patients said that they would have actually gone to an emergency department or a walk-in clinic for medical care for their ambulatory care sensitive condition. The majority said that they would see their family doctor or they'd try to get an in-person visit with their doctor. Visits were highly rated. Most patients, well over 2/3, rated it as 8, 9, or 10 on a 10-point scale. So ultimately, what we found is that this is, to our knowledge in the literature, the first study to evaluate the patient experience with telephone visits for ambulatory care sensitive conditions. We found that patients find these visits to be convenient, efficient, and effective for the management of ambulatory care sensitive conditions, and they're actually generally preferred over video visits when it comes to virtual care. Future directions, which we are already working on with our group, are to characterize the experiences of patients from more diverse demographic and linguistic backgrounds, to collect some more qualitative data on the patient experience, and to complement this data with data on provider experience with telephone visits for ambulatory care sensitive conditions.